Ladies and gentlemen, and thank you for joining the QAPI for Home Health Agencies Part 1 conference call. Your host for today is Andrea Laws. Andrea, you may begin your conference now.
All right, good afternoon or good morning, everyone, depending on where you are joining us from today. I just wanted to welcome you all to today's webinar presented by the Lake Superior Quality Innovation Network. My name is Andrea Lahoff, and I am a clinical quality consultant at MPRO in Michigan. Just to start off, if you would like a copy of today's slides, you can visit the QualityNet event page and enter the password HHAQAPI, which are all caps and no space, in the event materials section, and I will put a link for it in the chat. So we wanted to start off today with introductions just to see where everyone is joining us from today. So please, if you could, add your name, your state, and your agency that you're from in the chat. We would love to hear from you and where you're joining us from today. So now I'd like to introduce you to today's other speaker, my colleague Mark Lausch. Mark is a certified advanced alcohol and drug counselor and licensed master social worker, and he is also a clinical quality consultant here at MPRO as well. So I will go ahead and turn it over to Mark.
Good morning and afternoon, everybody. As Andrea said, I'm Mark Lausch, and I'm really happy to be presenting to you today. We'll start out with the objectives of the program today, and what we're going to hopefully teach you is to describe quality assurance and performance improvement, or QAPI, in the home health setting. We're going to provide you with an example of a QAPI self-assessment that you can work with your team at your agency to complete, and then for today's presentation, to identify guiding principles to lay the foundation for QAPI. Well, I'm going to start off with talking a little bit about what is the Lake Superior QIN for those of you that might not be familiar with it. We are a collaboration between Minnesota, Wisconsin, and Michigan, and this partnership came about as a result of legislation that was passed by Congress to allow for increased collaboration between QIOs and to reduce costs to the Medicare Trust Fund. Quality improvement networks and quality improvement organizations. Lake Superior is a QIN, or a quality improvement network. Minnesota, Wisconsin, and Michigan are QIOs, and they're quality improvement organizations. We help bring Medicare beneficiaries, providers, and communities together in data-driven initiatives that increase patient safety, make communities healthier, and better coordinate post-hospital care, and I guess overall improve the clinical quality of services being provided to Medicare beneficiaries. QIN and QIOs are skilled in creating opportunities for providers to learn from each other by applying advanced improvement in analytical methods, engaging patients and families, and structuring processes for sustaining positive change. And also getting together like we're doing today to provide information and share with you some best practices and some quality improvement information. Our funding for CMS started last August and will run through July 2019. And just to give you an idea of some of the areas, for those of you that might not be aware of this, some of the areas that the Lake Superior QIN is involved in, we are currently doing quality improvement work in the areas of hospital quality reporting, immunizations, cardiac disparities, diabetes, care transitions, nursing home safety, hospital-acquired conditions and hospital-acquired infections, behavioral health, PQRS, and meaningful use. So you can see we cover a lot of ground in the Lake Superior QI, and we do a lot of work in our respective states. Okay, we're going to now, there should be some polling questions that are going to come up here, and we're going to kind of ask you a couple questions to kind of just give us an idea where you're coming from. And the first question is, are you familiar with QAPI principles and how they can apply to the home health setting? And second, are you familiar with the proposed conditions of participation for home health agencies and how QAPI is involved? And I think we're going to get the conference operator, conference operator to put those up. The polling questions. we go. Okay. So if you can just take a minute or two and answer the two questions, and we'll get the feedback from your responses in just a minute. I don't have any Jeopardy music to play for you today, and I won't comment. Okay, if we could see the results.
10 seconds.
Okay, thank you. In 10 seconds, we will see the results. Okay, so what do we have here? I don't know what screen is yet here. What does it look like here? We said that 16 out of 35 are familiar with QAPI principles and how they apply to home health. And for question 2, 14 out of 35 are familiar with the conditions of participation, and about 7 of you aren't, and we had a few that didn't answer. So hopefully we'll be able to answer most of your questions on these as we move forward. Okay, now to the meat and potatoes here. The connection to quality. When we talk about quality, we have to be aware that it impacts everything we are doing in our agencies. Whether we're talking about conditions of participation, value-based purchasing, or the home health star ratings. Value-based purchasing is driving higher quality and more efficient care. The initial step is to get an overview of your agency's quality and the data you are producing, and knowing where to focus your efforts and where you can make the biggest impact. So these are all important concepts for you and your agency. Okay. The 3-step quality improvement process involves these 3 steps you see up here. So in order to improve quality, you need to determine where your agency's current performance is and what you want to focus on. So the first step is to look at where your agency is by assessing your agency's data. And a good place to do this would be HHQI's Home Health Cardiovascular Data Registry. There you can collect baseline data to see where you stand on any of the measures that you report on. The next step is, based on your data and reports from other sources such as vendors or EHR or your electronic health record, to decide where to focus your efforts, where the greatest need would be. And step 3 is to create a plan. How are you going to improve the data in the areas you have chosen using performance improvement projects or PIPs? I'm sure we've all heard of that acronym before, PIP. So that is a performance improvement project. And you could use, there could be other resources and strategies that you would use for this too. Okay, there we go. Okay, so what is QAPI? As you can see, the 2 puzzle pieces here, QA and PI actually work together as one kind of whole concept. So QAPI has 2 parts, quality assurance and performance improvement. Taken together, it is a comprehensive approach to ensuring high quality care. It is a data-driven, proactive approach that seeks to improve the quality of life, the quality of care, and the services in your home health agencies. It involves members at all levels of the organization, from top down, leadership and governance, all the way down to receptionists and I guess housekeeping if you have those there, to ID opportunities for improvement, to address gaps in systems or processes, to be able to develop and implement improvement or corrective plans, and continuously monitor effectiveness of intervention. So QA is quality assurance. Now this focuses on meeting quality standards and assuring the care you are providing is at acceptable levels. The focus is on the provider for the quality assurance part. Now the performance improvement piece of the puzzle is continuous study of processes. So the goal here is to prevent or decrease the likelihood of a problem. So the focus here is on patient care, and it hopes to be proactive, okay? And QAPI brings these 2 puzzle pieces together into a seamless whole. Okay, Now we're going to talk about the 5 standards of home health QAPI, or Quality Improvement Performance, Quality Assurance and Performance Improvement. So this slide shows the general framework for implementing a QAPI program in your agency. It is based on the 5 elements of effective quality management, and this information is taken directly from the CMS conditions of participation. Okay? So the 5 elements are your strategic framework for developing, implementing, and sustaining QAPI. So when you look at these, keep the following in mind. 1, your QAPI plan should address all 5 elements: executive responsibility, program scope, program data, program activities, and performance improvement projects, or PIPs. All these elements are very closely related, and you are likely to be working on them all at once. You wouldn't necessarily take one of these things and work on a particular problem and only focus on one of these things. The problems that you choose to work on, or issues that you choose to work on in your agency, you would involve all these 5 standards. They all need attention at the same time, because they will all apply to the improvement initiatives you have chosen. So your plan is based upon your own agency's programs and services, the needs of your particular patients, and of your assessment of current quality challenges and opportunities. Okay, now we're going to talk a little bit more in detail about the QAPI standard. I'm going to talk a couple of them, then I'll turn it over to Andrea, and she'll finish talking about the remaining standards. But the first one here is executive responsibility, which is requiring your leadership, which includes any governing bodies, to be responsible for your QAPI program. They have to be aware of your QAPI program and help define, implement, and maintain it agency-wide. It focuses on quality improvement and patient standards. You have to create a culture of QAPI. So QAPI must be instilled in everything you do from the top down. So this is important because in order to, as I just mentioned, to instill a culture of QAPI, that message has to come down from top to bottom and then bottom up as more people become aware of the QAPI program that you develop in your agency. Okay, so the second standard is program scope. This includes looking at your agency in kind of a big picture framework, right? So what your agency's quality looks like and where you can improve health outcomes. So for an example, one of your goals might be to reduce hospitalization. So there you might be able to start to measure, analyze, and track indicators of this issue or problem, which could include maybe identifying reasons for recent hospitalizations, looking at processes or procedures on interventions done before deciding on hospitalization, or maybe even top diagnoses that your patients may have that have recently been hospitalized. So while you're looking at the indicators, you would still keep your eye on the big picture, which is reducing hospitalizations. Okay, standard 3 is using program data. Okay, all 5 standards are interdependent and they don't exist alone. They support each other. A good example is the program scope that I just talked about, and program data. Program data is about collecting the data. If you're a small agency, it may be the same group or group of staff working many standards at the same time, or you may find different standards to specific staff. So depending on the size of your agency, you may have a lot of people working on your QAPI plan, your QAPI program, or it might be limited to a couple of people. But you'll need to be able to prove that you are doing each of these standards in some way, shape, or form while you're working on the issues that you've identified. So data is just not home health compare or HHQI reports. You may have vendor reports that you get every month as well, or you may get information from your electronic health record. Look at them all in detail and have an understanding of what they tell you and how the various data are different. Then by using the data, you can create a picture of what your quality is and start to figure out root cause analysis, or RCA. You can then use the data to assess quality of care and identify and prioritize opportunities for improvement. Okay, now I'm going to turn it over to Andrea, who's going to discuss the remaining QAPI standards.
All right, thanks, Mark. So I'm going to cover the next two QAPI standards, and the fourth one is program activities. So this activity is focused on areas in your organization that might be high risk, high volume, or problem prone, and it's taking into account the frequency, prevalence, and severity of problems in those areas. So with this standard, you want to start selecting what you're going to work on. You could have lots of areas based on all of the data that you've collected. And like I said, you want to focus on those areas that are high risk, high volume, and problem prone. So if you find any immediate problems that might arise, those need to be resolved right away, especially if they might threaten the health and safety of your patients. So once you address those areas, you also want to continue to monitor any changes that come up and also ensure improvements are sustained over time. And the last QAPI standard is Performance Improvement Project, or PIP.
Oops, let's get the slide. Yeah, we'll get the slide up for you here.
All right. So for this last QAPI standard for PIP, they're typically focused on one area, and this is where the rubber really meets the road. And you're going to be testing your intervention strategies that you've chosen. So you'll want to conduct your PIPs annually, and you want to reflect on the scope, complexity, and past performance of your agency services and operations. So for a performance improvement project, you are going to utilize data collection and analysis to select which areas you want to focus on. You can also look at any areas that were previously problematic for performance issues. You can look at evidence of poor patient outcomes and also those high risk and high volume areas that I've already talked about. So with this one, it's really important to not wait for your data to catch up to you. You want to know what performance improvement projects focus on at the right time. So you may have to wait anywhere from 12 to 16 months to get that data to catch up for results from your interventions. So this is a really great area where you can utilize the cardiovascular data registry. You get your data on a monthly basis through HHQI, and you will see within a couple of months trending for the data that you're inputting. You may want to make sure that you're using that data to drive your improvement efforts. And then lastly, you want to document your PIP as part of your QAPI project and how you're progressing through that. All right, so this slide is an example of how your QAPI plan should be at the center of all of your improvement efforts. So QAPI is really running everything. Your performance improvement project or projects that you've decided to work on could be running continuously. Just an example, you might have a cardiovascular PIP that you're working on, and then you may want to add one intervention for an infection control PIP. You might need to alter your plans as you are continuously incorporating more PIPs as part of your plan, but it's really essential to make sure you're monitoring them throughout the 5 QAPI standards. And here you want to look for declines and then also for sustainment and improvement. So next I'm going to be talking about the action steps of QAPI. So we've already talked about the QAPI standards for home health agencies and how it drives quality within your agency. So now the question is, how do you do it? QAPI is designed to help your facility to become more proactive and less reactive. And I've included a quote in here: life is 10% what happens to you and 90% how you react to it. So QAPI is designed to increase your knowledge for planning, implementing, and sustaining measurable improvements. After the conditions of participation are put into place, QAPI will most likely be a CMS requirement, and home health agencies will be required to submit written QAPI plans. So helping home health agencies become more proactive and to implement a QAPI plan is really what we are looking to try and accomplish. The next few sections that I'm going to talk about are going to outline the first few action steps that can help you on your road to implementing QAPI. And we'll cover the remaining steps in Part 2 of our webinar series. But these action steps don't need to be achieved in order, but it's important to note that each step builds on the other QAPI principles. So the most important aspect of QAPI is really effective implementation. So learning and understanding the principles is just the first step. All right, so the first action step to QAPI is leadership and responsibility and accountability. So creating a culture that supports QAPI efforts really begins with leadership. Support from the top down is essential, and that support should foster participation from each and every staff member. Executive leadership are the people who set the tone and should provide resources for QAPI. So with this action step, you want to put a personal face on your quality issues. So there are a few different steps that leadership can take to facilitate QAPI within their agency. Leadership can give staff the opportunity to meet with board members and other executive leaders to really generate support for their QAPI efforts. And QAPI also needs champions. So it's really important to choose the right people that are going to lead in collaboration with management and leadership. So some ways that leadership can take action would be to develop a steering committee. So this is a group that would provide QAPI leadership to your agency. The steering committee has the overall responsibility to develop and modify a QAPI plan, to review that information, and also to set priorities for PIPs. So understanding the data and making those selections for areas to focus on for PIPs. Leadership also would provide resources for QAPI, so that could include any equipment or training that might be necessary for your staff. And they also should establish a climate of open communication and respect. So leadership should consider having an open door policy, if they don't already, to communicate with their staff. And also to create an environment where staff would feel free to bring any quality concerns that they have forward. And also it's important to expect and build effective teamwork among staff. So the next action step is to develop a deliberate approach to teamwork. Teamwork is a core component of the QAPI principles. So you'll hear me refer to your team, or that the opinion of everyone on the team is valued. So I just wanted to give you some characteristics of an effective team. And the first is to have a clear purpose. So the team needs to know what they're trying to accomplish. Having defined roles for each team member to play, and also ensuring that each team member understands their role. And then also having commitment to active engagement from each member. So QAPI relies on teamwork in a few different ways. Task-oriented teams might be specially formed to look at a particular problem, and their work might be more limited and focused. PIP teams, on the other hand, those are formed for longer-term work, and they are typically focused on one issue. Thinking back to one of my previous slides, that you might have a cardiovascular PIP or a PIP focused on immunizations. So each one of those teams are focused on one issue. When you're chartering a PIP, you want to consider what the purpose of the PIP is and the type of members that might be needed to achieve that purpose, and making sure that you're selecting the proper members to be part of that team. PIP teams need to plan for sufficient communication so that the entire team can understand what's being accomplished. And leadership needs to convey that being on a PIP team is an important part of the job, that it's not just something to be put aside if other things come up, because these plans are what is going to be what's driving improvement in your agency. So the next action step is taking your QAPI pulse with a self-assessment. And in order to establish QAPI in your organization, it's helpful to conduct a self-assessment. So this is where you can see how your organization is currently performing and where you're at. As you continue implementing the action steps, you should periodically evaluate QAPI in your organization to see how far you've come. And you can do that by revisiting your QAPI self-assessment. So to get you started, you can use the self-assessment tool to take your QAPI poll. That will help you to evaluate the extent to which components of QAPI are in place within your organization and to identify areas that might need further development. So you can use this assessment tool as you start to work on your QAPI plan, and then, like I said, you can revisit annually or semi-annually as often as your agency would want to review it, and just use it for evaluation of your agency's progress. So you should complete the tool with input from your entire QAPI team. So getting input from the top down, also from your organizational leadership to every member of your QAPI team. And the self-assessment is really meant to be an honest reflection of your progress as QAPI. So the results that you get from the self-assessment are going to be what directs you to areas that you might need to work on in order to establish QAPI within your organization. So we've included a screenshot of the first page of the QAPI self-assessment, and I'm going to include a link to that in the chat. So if you want access to the QAPI self-assessment tool, you can access it from the CMS website, or it was also included in our webinar materials on the QualityNet webpage. But just to give you an example of some of the questions that are asked in a self-assessment, the first question is, our organization has developed principles guiding how QAPI will be incorporated into our culture and built into how we do our work. So for this question, you can select not started, just starting, on our way, almost there, or doing great. So this is a really good snapshot of how your agency is progressing with your QAPI plan, so you can see where you're currently at, and this is why it's good to include it as part of your annual or semi-annual assessment. For those of you in Michigan who are signed up for our Governor's Award, this is part of one of your first round of requirements. So you would have to complete your QAPI self-assessment just to see where your agency is currently at with your QAPI plan. The last action step that I'm going to cover today is identifying your organization's guiding principles. So with this one, you'll want to lay a foundation that will help you think about the principles that will guide your decision making and also help you to set priorities. Establishing a purpose and guiding principles will unify your agency by tying the work that's being done to its fundamental purpose. So taking the time to convey your purpose, developing guiding principles, and also to define the scope will help you understand how QAPI will be used and also integrated into your organization. This information will help your organization to develop your written QAPI plan. So there are a few steps to identifying your guiding principles. The first is to locate or develop your vision statement. And a vision statement is sometimes called a picture of your organization in the future. So that is your inspiration and your framework for your strategic planning. Just an example of a vision statement that we have is to create an environment where people are loved, valued, and at peace. So the next step to laying your foundation would be to locate or develop your organization's mission statement. And the mission statement is a little bit different. It's describing the purpose of your organization. And your mission statement should guide your actions of your organization and spell out your overall goals and provide a path and guide decision making. So a real quick example of a mission statement is, we are committed to enhancing quality of life by nurturing individuality and independence. We are growing a value-driven community while leading the way in honoring inherent senior rights and building strong and meaningful relationships with all the lives we touch. So step 3 would be to develop a purpose statement for QAPI. And what this is a statement that describes how QAPI will support your overall mission and vision of your organization. So if your organization doesn't have a vision or mission statement, you can still write your QAPI purpose statement and then state your organization intent, what your organization intends to accomplish through QAPI. So an example of a QAPI statement would be, the purpose of QAPI in our organization is to take a proactive approach to continually improving the way we care for and engage with our patients, caregivers, and other partners so that we may realize our vision too, and then you would insert your vision statement. And to do this, all employees will participate in ongoing QAPI efforts which support our mission by, and you would insert your mission statement. And then the last step to identifying your guiding principles would be to establish those guiding principles. And those describe your organization's beliefs and philosophy related to quality assurance and performance improvement. So the principles should guide what the organization does, why it does it, and how. So I did include an example on the slide of what a guiding principle would be. And that example is our organization uses quality assurance and performance improvement to make decisions and guide our day-to-day operations. So those are just the 4 steps that you can take for this action to make sure you're identifying your organization's guiding principles, which would lead to your QAPI plan. All right, so at this time, I'd like to pull up the evaluation questions really quick. And just take a moment to let us know how we did by filling these out. And I also would like to open up the lines for Q&A. Operators, can we open the lines for some questions and answers?
You can also post your questions in the Q&A or the chat box. Either one is fine.
No problem. Hold on one second. Let me give the instructions. Ladies and gentlemen, at this time, if you have a question, please press the number 1 key on your touch-tone telephone. Again, ladies and gentlemen, if you have any questions at this time, please press the number 1 key on your touch-tone telephone. Our first question comes from Iris with Harvard Partners. Go ahead with your question. Hello, Iris. Your line is open. Go ahead with your question. Our next question comes from Janet with Bay Nursing.
Hey, Andrea, this is Janice Fowler from Bay Nursing. How are you?
Good, how are you?
Hey, good. I just had a question. Could you just go over one more time what you said about, you were giving us examples and what elements should be in the purpose statement, not the mission statement, but the purpose statement. Could you go over that with me one more time?
Yeah, so the purpose statement, it is including your vision and your mission statement. It's basically just describing how QAPI is going to support your mission and your vision within your organization.
Okay, so stating how QAPI is going to actually help us incorporate and help us develop or create a vision, and then we'll include my mission statement. Am I understanding that correctly?
So it's just stating what the purpose statement is describing what you're doing for QAPI within your organization and how that is being supportive of your mission and your vision.
Okay, great. I understand now. Thank you so much, Andrea.
Yep, not a problem.
Okay, we have another question. Where can I obtain the slides for today's session? Actually, the link for that is in the chat at the very top of the chat box. The link is there, and Andrea can put it in again.
And we will also be, we've recorded this webinar, and it'll be available on our YouTube page. So you can, we'll send out the link for that as well once we have the recording. But I will go ahead and I will put the link to the slides in the chat. And just a reminder, the password to obtain the slides is HHA QAPI, and that's all caps and no spaces.
Do we have any other people on the line for questions? Because we do have one in the Q&A, and I'm going to give the people on the phone lines first shot at that.
Okay, let me give the instructions one more time. Ladies and gentlemen, at this time, if you have a question, please press the number 1 key on your touch-tone telephone. Again, ladies and gentlemen, if you have a question, please press the number 1 key on your touch-tone telephone. Our next question comes from Devin with Premier. Go ahead with your question, please.
Oh, hi. Great presentation. I just want to know what is the HHQI cardiovascular registry?
Yep, so that is a data registry through HHQI where home health agencies can input data related to the ABCS measures, so aspirin, blood pressure, cholesterol, and smoking. We will go more into detail on how you can use the HHQI data registry as part of your QAPI plan in part 2 of our webinar series. But just for a general, to answer your question, it's just where agencies can input. There's one question per measure, and you would get your monthly data reports back from HHQI.
There are no more questions in queue at this moment.
Okay, thank you. We do have one question in the chat. It's when will QAPI become a requirement for home health agencies to submit to CMS? Unfortunately, we don't know when they'll become a requirement. Right now, they are just proposed. But from past experience, we know that when these are proposed, that they will eventually become a requirement. So what we're trying to do is really prepare you for when it does become a requirement. So you already have a written QAPI plan in place when to submit to CMS when this does happen. Do we have any other questions in the queue?
Okay, we have another question that just came in from Janice with Bay Nursing. Janice, please go ahead with your question.
Hi, Andrea. Hey, look, I was trying to click the link because I would like to have copies of the webinar, you know, your slides. I'm not getting there. I don't know. I clicked the link and it took me back to the Quality Net University where I have to like join now in the webinar, which.
Yeah, if you scroll down to the bottom of that page, you'll see where it says event materials, and then you'll have to enter a password. So that's where you'll enter the HHA QAPI password. And once you click view info, the two materials should pop up. So the slides are included in there, as well as a digital version of the QAPI self-assessment tool.
Okay, I think I got it. All right, thank you.
You're welcome.
Again, ladies and gentlemen, at this time, if you have a question, please press the number 1 key on your touch-tone telephone. If you have a question at this time, please press the number 1 key on your touch-tone telephone.
And we did get another question in the chat. Is the self-assessment the same as what was given to the skilled nursing homes? And the answer is yes. There hasn't really been much materials developed by CMS specifically for home health agencies. What's currently out is what's been used in the nursing homes. So that's the only materials that are available right now. And I'm hoping, I know a few of you mentioned in the chat that you're having the same issue with obtaining the slides. I hope I answered your questions with that.
Okay, we have a caller that has a question. Our next question comes from Maureen with Elmsmar Home Health. Maureen, please go ahead with your question.
Elmsmar Home Health Care. I just wanted to know if this webinar was available for viewing after this.
Yep, we are recording the webinar, and it's going to be on our Lake Superior Quality Innovation Network YouTube page, and we'll make sure that we send out the link when it's available on there.
Thank you.
Yep.
Our next question comes from Pamela with Crinton Home Care. Pamela, please go ahead with your question.
Hi, Pam.
Does this, I know that hospices had to do QAPI for a while, and this is applicable to their requirements also? Or?
As far as I know, this is based on what the nursing homes are completing. I'm not sure about hospice, but so all of this information, aside from the 5 standards, are based off of the nursing home information.
And they're basic QAPI building blocks and principles too, Pam. So this is Mark. Yeah. So I think they're going to be pretty similar.
Thank you.
You're welcome. Thanks for viewing today.
Sure.
Again, ladies and gentlemen, at this time, if you have a question, please press the number 1 key on your touch-tone telephone. If you have a question at this time, please press the number 1 key on your touch-tone telephone. Okay, there are no more callers in queue for questions.
Thank you so much.
Thank you. Just as a reminder, please complete our brief evaluation just to tell us how we did today. And I just wanted to remind everyone to join us for part 2 of our QAPI series. Next week we'll be talking about the remaining action steps to achieving your QAPI plan, and we'll go into a deeper dive on how you can use the Home Health Cardiovascular Data Registry as part of your QAPI plan. So before our next session, we would like you to review and complete the QAPI self-assessment tool if you haven't already, especially for those of you that are in Michigan as part of our Governor's Award. And I have put the link for that in the chat. And then also work on to develop a purpose statement for QAPI. So you have a few homework assignments. I bet you didn't think you were going to get homework.
But we left you out a little early too, so that's the trade-off for the homework versus we give you an extra 15 minutes in your own shower, hopefully.
All right, so thank you for joining us today.
Thank you for being here.
We look forward to you joining us for next week on January 26th at noon for part 2.
Ladies and gentlemen, at this time, this concludes your conference call. You may all disconnect.